When I use the Alfred Alert sensor, it reminds me to check on myself and make sure that my ostomy bag is okay. It has also really helped me in keeping track of my hydration. I tend to get very dehydrated very quickly having my ileostomy bag.
It eliminates my worry. I no longer have to go out and hang out with friends or go to work and have to worry about my bag leaking.
Fluid balance can be a real issue with these patients, and having anything that gives us real-time data about what's happening with the fluid balance of these patients and presumably and predominantly the stoma output is going to be a real benefit in managing them.
Not only can my doctor see my data, he can look at it from the comfort of his own office, and the doctor is able to see the trends throughout that whole time. So giving the doctor this advantage has really made it a lot easier for me to keep in communication with my doctor for problems to help prevent me from being hospitalized. The Patient Champion program has changed how I view my life, because before I didn't really know there were other ostomists out there that were my age and that went through the same thing that I did. And you kind of have a different outlook after you talk to a patient champion.
It has established a wonderful support group, a wonderful community for ostomates like myself, but also they are encouraging them to manage their own health.
We've now found out how to make them more effective, how to keep them accurate in terms of measuring fluid output. And we're also getting data that shows that patients find them acceptable and usable, and find that the app and the desktop and the other applications that back this up are useful for the patient. Continual recording of stoma output and fluid balance is going to be beneficial to a patient because it means that we can cut the cord between the patient and the team. Often when we're worried about a patient's stoma output, we're keeping them in hospital longer, we're requiring them to come back frequently for visits, and we're doing multiple blood tests. If a patient can monitor themselves at home, and we've got a way of accessing that data and feeding back to them if changes need to be made, it means we don't need to see them as frequently. That's better for the patient, it's better for us, and it's better for healthcare in general. So 11 Health are now providing a number of services that are beneficial for the patient and the team. The first and the most important is just connecting the two together in the form of information streaming between them, but also a point of access, a point of communication, so messaging between the patient and the medical team.